Hello, Assalamu alaikum. This is Dr. Faraz Ahmad, and this video is typically for my nurses colleague. In this video, we are going to discuss about a case note and how we will skim and scan that case note. And after doing this, how we will write a letter from the case note. So in this video, we are going to discuss a referral letter. So I will tell you in detail how we will proceed with the case note and how we will only convert the important and the relevant information into a letter format. So let's move to the laptop screen. Okay dear, so now we are on the laptop screen, and here you can see that this is a case note and we have to convert this case note into the letter format. So you people must be knowing that when there is a case note in front of you, so how we will start reading the case note. So when you are in the exam, when you are practicing for your writing and there is a case note in front of you, so how you will start reading the case note. So first of all, what you have to do, please go to the writing task without wasting your time. So we will come here on the writing task, and after reading the writing task we will have a clear idea that which type of letter is this and where we are going to refer or discharge the patient. So we will read the writing task. Write a referral letter. So this is a referral letter to Dr. Jenny Hensey, and a psychiatrist. Okay, outpatient clinic, Newtown Hospital. So it's mean like this is a referral letter and we are referring to the psychiatrist. And please keep in mind, as I have told you people previously in my videos, that you have to include three things in your introduction paragraph. Number one is the patient detail, number two is the diagnosis, and number three is the plan. So up till now we don't have any information. We don't have patient detail, we don't have diagnosis and purpose of the letter. We only know that this is a referral letter. So after doing this, what we have to do, we will move just above the right. This is the writing task and we will move just above here. So we will read the recent one. What is the patient health status on the 2nd of the December 2018? Patient is conscious and drowsy, okay, and pale as well. Patient vomited, tolerates soft diet and the oral liquids, and the patient shows disinterest in the life. So please keep in mind the important things, important information which we have to include in the letter. I have given them red color. Okay, patient is not showing any interest in the life, so we have planned for the discharge on the 3rd December if the reports are normal. All right, so what is the discharge plan? Review with the toxicology and refer to the psychiatrist for the assessment of the ongoing care. All right, so this is a referral letter, and what is the purpose? We are going to refer to the psychiatrist. So this is the purpose of letter. So two things, we have only one thing which we have to include in the introduction, and this is the purpose. So purpose is what? We are going to refer to the psychiatrist. This is the purpose of letter. So now we have to search for other two things, that were the patient details and diagnosis. So here you can see, when we will start reading the notes, you are a registered nurse working in the emergency department, and Miss Ayoso is admitted to your department. All right, so here you can see patient detail. This is the name of patient and this is the age of patient. Miss Ayoso, 25-year-old. So three things to include in the introduction. One is the patient detail. We have patient details. These are the patient details. One is the diagnosis. We have to search for diagnosis. And the third one, the last one, is the what? Third information is the purpose, that was referring to the psychiatrist for assessment. All right. So now, because as we are referring to psychiatrist for the mental evaluation, so definitely we will include the marital status. I have written in the red. What is the patient profession? Accountant. Patient next of kin to patient is the mother, and admission date. Patient presented on the 1st December 2018, and on the 3rd of December 2018 we will discharge the patient. What is the social history? In all the psychiatrist cases, social history is very important. Patient lives along with the mother. All right, so what is the previous medical history? Because we are referring the patient to the psychiatrist, and we have to focus, either patient has any drug overdose, any drug allergies, any history of the mental illness, any medical issues. So patient don't have any drug overdose, any drug allergy, and no mental illness and the no medical issues previously. So we have to include all this information in the social history paragraph. So what was the problem with the patient when patient presented on the 1st of December? What was the problem? Patient presented with slurred speech, headache and diaphoresis after consumption of 20 tablets of paracetamol after taking one bottle of mine. So this was the problem, and you people must be knowing that once a patient present with any overdose of paracetamol, first the medical team will manage the patient. After the complete management, what we will do, we will refer to the psychiatrist, so psychiatrist can do a mental evaluation. So this was the presentation of patient. Patient vomited 2 times, drowsy, pale, vital signs were this, and patient respond to the verbal commands and GCS was normal. So you are the nurses, and this is the important point for you. So what was the focus of your nursing management? Your nursing management, admission for observation, and you will have to do the you were supposed to do the blood test. You did these blood tests, and you were supposed to do the chest x-ray, urine test, vitals and the GCS orally. So these were your duties. These were basically your duties, and you were supposed to do the observation of the vitals and the GCS every hour. And antidote N-acetylcysteine, the normal saline was started. This was also included in the nursing management or the nursing duty. So this is the main focus. All right. So patient health status on the 2nd of December, patient presented on the 1st. On the 2nd December, patient was conscious, drowsy and pale, vomited, subsided, IV medicine stopped, and the patient was tolerating the soft diet and the oral. But patient was disinterested in the life. Okay. So what were the plan for discharge on the 3rd December if the patient reports were the normal? So this plan was made. And the discharge plan was review the toxicology and refer to the psychiatrist for the assessment of the mental condition. So now we have to write the letter. So you can see I have divided this letter into different headings. This is just for your ease. Please don't make these headings in your exam. Okay, first of all, so we will write the address. Address is given there. This 3rd of the December 2018. Dr. Hensey, psychiatrist, outpatient clinic, Newton Hospital, dear Dr. Hensey. We will write the reference. So in the introduction, this is the introduction. I mentioned that you have to include 3 things: patient details like patient name and age, diagnosis of the patient or the complaint of the patient, and the purpose of letter. So we will write patient name is Ayoso, patient presented with paracetamol poisoning or the overdose. Our plan is to refer to the psychological assessment. So how we will write? I am writing to update you regarding, or you can write I am writing to refer. Just simple is that. Okay, you can write I am writing to update you regarding Miss Ayoso, a 25-year-old accountant who is being referred into your care. Okay, what was the diagnosis? After an eventful recovery from paracetamol overdose, or you can write uneventful management of paracetamol overdose. So she is stable now and needs your psychological assessment. So psychiatrist will do the assessment. This assessment will show that either patient is going to do this again in the future or not. So second paragraph after the introduction is the social history paragraph. So social history, what was the important? Patient is single and lives with her mother. Regarding the patient problem, like this was a suicidal attempt, these 2 things, single status and lives with the mother, these were the important. And her past history is unremarkable for any drug abuse or the mental illness. That's it. So we will make another paragraph for the presentation. Patient presented initially on this date, presented with these complaint. Okay, and what was the reason of these complaint? After taking 20 tablets of paracetamol with 1 bottle of wine. Okay, so patient presented, then what you did the examination. She was drowsy, pale, however her GCS was normal. So what you did, first you have written presentation, then you have written examination, then after doing this what you did, an antidote N-acetylcysteine was commenced and relevant blood tests including this and this were ordered. Then this is the main. Her nursing care was focused on early monitoring of vitals and GCS. This is very important. If you are going to miss this in this letter, you will fail. All right, because you are nurses, and this point is very important for you people. Then we will write about the current status. On the next day, there was an improvement in Miss Ayoso's condition, and as she was conscious and was tolerating soft diet and oral liquids. What is the important point in today's status? Please note, she is not interested in life anymore. This is the important point, and this is the main reason we are going to refer to the psychiatrist. Okay, don't miss this point, and don't miss this point that nursing care was focused on. These 2 points are the life of this letter. Then conclusive paragraph: in light of the above, I am sending Miss Ayoso into your psychiatrist care for further assessment of her mental illness and ongoing care. You can use a better word here, for further assessment of her mental status. Okay, instead of illness, you can write status. Then you will write, should there be any queries, please do not hesitate to contact me. Keep in mind, these words are not included in word count. Yours sincerely, and charge nurse. So this was very basic and very easy case note, and I have discussed this letter so that you people can feel ease that how to write a referral letter. All right, hopefully I am going to make few more videos regarding the different types of letter which come for the nursing exam. And if you want our services for letter evaluation and speaking, you can directly message us. WhatsApp number is given in the description. Thank you very much.